As Q, the first slide is going to be the meeting information slide. And for those of you who are already hearing the call, you've got that successful piece. If you have any technical details, please contact Jenna Frickovich at iphionline.org, or you can also just send an email to info@connect.org. So great. Next slide, please. So on today's webinar, we're going to have close to 100 people, and so we're muting folks and encouraging you to use the question mark box that you'll see to the upper right of your screen. Please submit your question there. We're going to answer as many of the questions as we can get to today. If we don't get to some of your questions, we will follow up, and all questions will be posted at the -connect.org site as part of our FAQ. Next couple slides. So I know that some of you are familiar with data across sectors for health, but I do want to spend just a little bit of time setting the stage for what we've been doing for the last 4.5 years. We are a national program office of the Robert Wood Johnson Foundation, headquartered here at the Illinois Public Health Institute. Our partner in this work is the Michigan Public Health Institute. And together, we sort of focus on these three things. We support grantees and awardees, we build the evidence base, and we do a lot of networking to build relationships for the field. Next slide. So one of the things that's exciting about this work is after we started to do it, we found other friends around the country, other organizations, other national and state organizations who were working on multi-sector community-based data sharing. And so we formed, together with some of these other partners, All In Data for Community Health. So you can learn all about data for community health, All In, at our site, allindata.org. I'm guessing that most of you have probably heard about All In already, though, because you get the All In newsletter. And so we kind of think about the work that we do at DASH as sitting in two very connected places. So our work is very specific around local initiatives. And so our three ways that we focus are around data and information sharing, multi-sector partnerships who are working collaboratively. So that's DASH. At the same time, as part of this national learning collaboration, we are working on what we think of as a movement around building systems that support work on the social determinants of health, really building a solid evidence base so we can say what works and what doesn't, and really importantly, building this network that's powered by peer learning. We really strongly believe that the answers are in the room. So in order to sort of really push that, what we did is build, next slide please, we created this mentor, the DASH Mentor Program. And so these next few slides, you have all this information, so I'm not going to read the slide to you. But I will say that when we thought about what does the field need next, is that we know that there are a lot of organizations around the country that are doing really high work and high quality work, and we wanted them to kind of stay involved in the All In network. And so we thought of a way to encourage these high quality organizations to stay involved in All In by connecting them to other organizations that are earlier in their journey toward collaborative multi-sector data. And so we have selected the 6 mentors that you'll hear from in just a couple of minutes to continue to support their work in this field, but also to very explicitly support them to mentor other communities. And so there's a lot of purposes here because that's how we do things at DASH. But we're really trying to support collaborative efforts in your local communities. We're really trying to build your capacity to to participate in these multi-sector efforts. We're doing this in a way so that it builds this all-in network. We're also going to be spending quite a bit of time documenting things that you're trying, that you're succeeding at, that aren't working as well, so that it builds that evidence base. And we're really trying to say to the community at large, to this field at large, all in is a place where this work is really being discussed and learned. Next slide, please. So in order to do that, we're supporting mentors to do some pretty specific things. You will find, as we have found, that these mentors all have different strengths. They have different capacity. They have different ways of doing their work. And so the Data Across Sectors for Health team is really sort of saying, we want the mentors to provide a high quality mentorship experience for the selected mentees. And so we want to give the mentors a lot of room to do this. But still, the focus for the mentorship is around a specific topic and a set of activities where the mentor will guide the group of mentees. The mentees will work with each other in their own communities and with their mentors. And so all of the mentees will have goals for learning and action, and they'll also be contributing to what we all know to be true about this work within the All-In Network. Next slide. So I want to say a couple of words about the mentors as a whole. I am so excited about this group of folks. These are all people who we know at DASH, either because we have formerly funded them or because they have been active in All-In with a different funding program. And so these folks are really, really exciting. They're all committed to their own communities, and they're very committed to this idea of how can we help other places that are sort of earlier along the journey. And so these are the six, and I'm not going to take away from their time to introduce themselves, but I just say that I've gotten to know most of these folks really well and personally over the last 2 to 4 years. And I think, honestly, I think that any of you could learn from any of them, but we are trying to make the mentorship sort of, gathering around a specific topic. So next slide, please. And so the University Center for Social Research is really about open data, civic data, community engagement, and really kind of getting started on this journey. The Civic Canopy, those guys Bob is out of Pittsburgh. The Civic Canopy from Denver, they're very involved in community engagement. They're working on a framework related to health indicators, very much thinking in terms of strategic planning. You may know about 211 San Diego, really on the forefront of sort of how 211s work and advance and grow, and they've got a lot of attention because of their community information exchange. Health InfoNet is a long-time grantee of DASH out of Maine. They're the state HIE, and they've been working on a bunch of different things related to the intersection of social determinant of health data and HIEs. The Center for Outcomes Research and Education is actually part of a really well-respected health system, and they're going to be available to work on care data linkages and integrated data. And then finally, we have the Corporation for Supportive Housing that is really working on housing homelessness, has a lot of facility with the Housing Management Information System, and will be especially available for organizations that are continuums of care. So as the mentors give their pitch, I want you to be thinking about what you're hearing, how it connects to the kind of things that you're interested in working. When you do your application to become a mentee, you'll select a first choice and a second choice. The final choice will be made by the DASH office and in consultation with the mentors. Next slide, please. We're going to select about 30 organizations in total as mentees. And so most of the cohorts will be 5 to 6 mentees. There'll be the Corporation for Supportive Housing will have a very specific program, so they'll have 3 mentees. The contract will be for $5,000 to support your staff participation. We know that even though we think that really, a 10-month relationship with any of these mentors would really be worth your time, but we also want to respect the fact that it takes staff time to participate fully. And so the timeline is there. The applications are going to be due on November 9th. We know it's a short turnaround time, but we also trying to make the application a pretty low lift. We don't want this to be so burdensome. We'll notify everybody by the end of November, and then we're going to get started right away in December. We know everybody's busy, but we feel like we've got a lot of momentum around the mentorships, and we don't want to slow down. Next slide. So again, the next few slides are about criteria and guidelines. I don't need to read these, so I'll just say that make sure that you do read the criteria and let us know if you have any questions. We really want to know that you have an idea for yourself of what you want to have happen as a result of being in a mentorship for the next just short of a year. Next slide. It's important to recognize that one of the purposes of this project is to sow participation within the All-In network, and so you don't have to be a member of All-In to apply for the mentorship, but if you are selected, then you'll join, because the All-In network and the online platform are going to be the home for the activities that are going to be happening throughout the program. And we'd encourage you to join at any time. I mean, not everyone who's on the call or applies will be selected, but the All-In online community is a place to connect with other folks who are trying to do the same kind of stuff that you're doing. Next slide. So the way that you join the All-In network is go to allin.healthdoers.org. And then at that point, you'll create an individual profile. It's important for you to recognize after you join that you want everybody who joins to be under the same collaborative project name. Don't worry if there's problems. We have lots of really smart staff people who can help you. I personally think that our online platform is just about as good, if not better, than most of those out there, but all online platforms have their quirks, and so we will help you get through that. Next slide. So mentees who are selected will participate in a webinar with your mentor. Then you'll develop an individual goal and participate in quarterly calls with all of your fellow mentees. Depending on the relationship that the mentors are arranging, there'll be different ways that you're in contact with each other. We'll have a way to pay attention at the NPO as to what you're learning and what you're experiencing. We do have folks on the team who are dedicated to this project, and you will learn about them. You'll complete an assessment, and depending again on the mentorship, you may contribute to the development of brand new materials. And so, next slide. So there's a lot to digest in this program. We at the NPO have been really clear with the mentors that this is something new that we're trying. And so I want to turn it over to Bob to do the first of the 6 mentor pitches. Each will be 5 minutes, and I will keep them to their timing. And so Bob Gradek, if you'll get started, that'll be great.
Sounds good. Yeah, I am here, and I'm going to talk to you a little bit about our project, our work, and talk to you a little bit about what we're looking forward to in the mentorship. So I'll move fast. Let's take it away. So about us, we can move on to the next one. So here in Pittsburgh, I work at the University of Pittsburgh. We manage a shared regional collaborative open data portal. We take data from our partners in government, nonprofit organizations at the university, and make that available to a lot of folks in our community. So we manage an open data portal, have about 20 or so publishers, all sorts of different shapes and sizes, and have learned a lot from that as well. So next slide. We also have set up a legal infrastructure and a governance infrastructure. So with a 2-page agreement, we can share data with, we can accept data from other organizations, and then our partners on the project are the City of Pittsburgh, Allegheny County. A key part of our work is actually providing data intermediary services. So we are partners in the National Neighborhood Indicators Partnership. We do a lot of technical assistance and a lot of data literacy workshops as well. So hopefully you'll learn from our experience there. What we've learned in the 3 years since we've been doing this, kind of a lot of different things. So personal relationships matter, building trust is vital. Our project is built on top of 10 years of small project work in our community. Wouldn't have happened without that. Next slide, please. I think we skipped one. So your infrastructure is really important. The choices you make impact your long-term sustainability. So I want you to be aware that I will help you think about the choices that you make early on, because I think it's really important that you avoid as much technical debt as you can. Staffing too is important. So next slide. Experience we have is if you build something, it could be the best website, people probably aren't going to come and use it. And this is a slide just picking on the pirates. You know, you've got to actually get out there and engage with your users. It also helps to have a solid value proposition, something we'll also help you develop. That value proposition could be a champion, like the mayor saying it's important to share data. It could be individual staff saying, you know, I'm doing the same thing 20 times a month. It would be great if I could work with you and save some time sharing data. Or it could be building a tool that uses data. But there's a lot of value in building a data ecosystem, so we're going to help you think through your role in a broader ecosystem as part of this project as well. Thinking about this intentionally has helped us think through roles in the ecosystem, what we should or shouldn't be doing. Also thinking about the kind of relationships we'd like to establish and strengthen along the way. Next, please. So there is no one model for building a local data sharing partnership. What comes out of your mentorship might not look anything like what we're doing in Pittsburgh, and that's okay. We acknowledge that, and we think it's really interesting to see how this stuff evolves. But what we're going to bring to the mentorship, so it's going to be me and my team. So we have the expertise in managing the data repository that we have, documenting data, metadata, managing data, data privacy, data transformation, and software development. But we also do things like training around data literacy, technological literacy, statistical literacy, technical assistance, applied research, human-centered design, and community engagement. We also think it's really important that you can leverage us for our connections to external networks. Our big one is the National Neighborhood Indicators Partnership managed by the Urban Institute, but also connections with chief data officers in many cities, librarians, Code for America. We have a lot of experience as a mentor as well. Get a lot of calls from people all over the country. We're always happy to talk and offer assistance. But what will this look like? So this mentorship is going to involve an ecosystem mapping activity. We've actually done this through our civic switchboard project that we're part of, looking at building librarian roles in civic data ecosystems. And so we're going to walk you through that same exercise. We're going to sit down with partners in your community and map out exactly how the relationships look at roles, and look at where connections could be. So with that in mind, you're going to then develop goals and a plan for your engagement. So you'll sit down and say, what are we going to do? You know, work with your partners in your community to see what we could do over the next 10 months. And then, you know, I really like using planning canvases, and this is just one example that we've done for the Civic Switchboard projects. But we're going to do a lot of this kind of activity. So it's not just going to be doing things, but structured ways of doing that. But we're also excited to be your thought partner. You know, happy to talk to you in scheduled calls, or if you just have an idea that you want to bounce off of somebody, we're happy to be an audience for that. So this mentorship is really just right for you if you're interested in civic data, open civic data, community engagement, neighborhood indicators, managing data sharing partnerships, and establishing community infrastructure. I'd say communities in the earliest stages of their partnerships are especially encouraged to apply. So if you have any questions, throw them in the chat. Happy to deal with that, but I think I'm in on time. Thanks.
Thank you, Bob. That was perfect. I knew that you would be right on time, and I appreciate you getting started. Just a note to folks, continue. We've got 3 questions so far. Continue to throw them in there, and we're going to get to all of them. Next, I want to go to Bill Fulton in Denver. Take it away, Bill.
Great, and a special thanks to Bob for kicking it off. It was a great presentation. Morning, everyone. Bill Fulton here with Civic Canopy. We're a nonprofit based in Denver, as Peter mentioned earlier. We thought about just describing our work as helping everyone that wants to figure out how to live in a complex world, but sadly that was already taken by the Lakewood Auto folks. So next slide, please. The way we describe our work is really helping the many work as one for the good of all. These questions of data and technology often come down to just fundamental questions of collaboration. So our kind of work stems from this summation in this little diagram here of a community learning model of whatever else you're trying to take on, whether you're working with data or just trying to improve your community. There's a pattern of effective practice that research suggests that will help you do that more effectively, and that's what we're kind of grounded in. I'll walk through some of the details about that. If you hit the next slide, it'll animate my cool little graphics there. Oh, if you can come back to those patterns, sorry. But broadly speaking, the work we engage in is helping people build connections, building their capacity as an organization or as a community, and then connecting those dots into a larger movement across your broader community. Thanks. Next slide. From a practical standpoint, the work we engage in always, as I said, doesn't matter what the topic or context or geography is, it's basically creating this ongoing effective practice cycle, very much as Peter, as you kicked it off, this network of learning in an experimental way. We help organizations, networks, communities ask some pretty basic questions. What are your results that you're after, the end you have in mind? How will you measure that? What do you want to move? How do you include those key partners in your community and engage in thoughtful dialogue, understanding different perspectives? Then we try something, how are we going to get to the desired end that we see? A huge emphasis on stepping back and learning from both our mistakes and our successes. What could we do differently? Continue that learning cycle, and over time, really creating this culture that lasts from project to project and from network to network. And that's, those cycles, rinse, cycle, and repeat, are pretty much the heart of the work that we engage in. Next slide, please. So what this has looked like in practice in communities ranging from rural communities wrestling with mental health holds, how do you reduce those over time, helping people find resources they didn't realize they had, and improving the stabilization of folks experiencing mental health holds, improving student achievement by looking carefully at data, helping teachers and schools improve their practice that way, reducing obesity rates, and some of the highest obesity rates county in Colorado, helping local communities on a block-by-block basis get access to more healthy food, or reducing crime in neighborhoods that are kind of filled with kind of lack of social cohesion and connection, and bringing those neighbors together. So again, a variety of contexts, these methods and approaches just seem to be the kind of the heart of the matter. Next slide, please. So what we're excited about in addition, so anyone that would be interested in working with us, we'd love to help you create your own success story like that. What is it that your community cares about making a difference on? How do we get there? But in addition to that, we've found that one of the things that makes the world of data informed decision making hard is that there's an enormous fragmentation in those that work with data. Everybody's got their own sets, their own language, their own parameters. We're interested in imagining how you would map these different data sets into a common framework. So a slight advance here to animate the slide. Our thought is that if we start thinking about the different domains people care about, next animation, think about them across a life course from birth to death. That's the second axis. And the third one being, what level of the socio-ecology? Are you talking about individual outcomes, organizational or community outcomes, or systemic outcomes? That framework pretty much gives everybody a coordinate system of whatever other indicator sets they're working on. We could kind of talk about a common language. So in addition to helping you solve your individual community-based problems using the methods I've talked about, we'd love to see if those could add up to something larger and kind of a coordinate system for data structures across the community. Next slide, please. So if folks might be a good fit for the approach that we have, if you're interested in these kinds of things, we'd love to share with you this research-based model for engaging communities on any type of issue. giving you access to the tools that we've built and that we've borrowed and built kind of a toolkit around. Obviously, the customized coaching to get your goals met. But if you like this idea of building a larger framework, we'd love to work with you on that. I think that's it. Thanks so much.
That's perfect, Bill. Thanks very much. All right, we're going to keep going west from Denver out to San Diego with Karis Grounds from San Diego 211. Karis, take it away.
Great. Thanks, Peter. So I'm Karis Grounds, working at 211 San Diego Community Information Exchange. Just to give a little background, many of you might know what a 211 is. 211s are across the nation. We're not just local to San Diego, although we operate mostly in San Diego. There's 211s across the country, and the Community Information Exchange is what we're focusing on for this project, and that's really an ecosystem comprised of multi-sector disciplinary partner networks that really shares language and an integrated technology platform to advance community care planning. And so we've kind of developed a unique approach to that in San Diego and looking to help other communities replicate that across the nation. And so really what that comes down to in this first slide is really thinking about it. The why behind it is really health equity is really at the core of what we're kind of talking about. And we know that when zip code is a better predictor than genetic code, we see that in San Diego specifically. If depending on what zip code you're in, you may have access to resources or access to certain services differently than in certain zip codes, or your life expectancy changes based on where you live. Those are important factors that we're really trying to connect the dots on what's going on in these communities and what resources and supports do we need to better connect communities and people with to improve those situations and really address some of the high level and underlying issues that are happening within our communities. If you go to the next slide, the problem is really, if you look on the left-hand side, we have our networks are really built in silos, and people are, information is being shared in all these different networks. And the solution is really moving to a person-centered model. And so the goal of moving to a person-centered model through the Community Information Exchange is really through a technology platform, but also really shifting the way that communities and people are working with each other, so that we're really focused on connecting the individual to these services in a more human-centered way. So if you go to the next slide, what this is really trying to do is a lot of systems change work. And so that's really, how do you measure the impact of on what you're making? How do you really prove the ROI? And I think that's a challenge across the nation, is understanding that. How do communities create shared language and goals? As we're trying to work with healthcare and social services, everyone's using different language. How do you really compile that and be able to create cross-sector collaboration between health and social services and government? How do you create trust between these different organizations and systems as you're moving towards system change work? How can communities be inclusive with all the needs, populations, and sectors? You really want to make sure that we're thinking about the whole person and addressing really upstream impacts. So how do you do that? How do communities create workflows and incentives that work for everyone? And so as we understand cross-sector collaboration and bidirectional referrals and longitudinal client records, how do we really work across these different systems together and create the workflows that work well? And how do communities provide ethical, informed care across sectors? So these are all huge questions that everyone's trying to solve, and really that's what this Community Information Exchange is striving to do. And so our mission is really to bring community-based organizations or community organizations together and help really connect those services. So we're a nonprofit organization who has a really grassroots perspective. Most of our staff are social workers, are public health workers. And so as Peter kind of mentioned in the beginning, we've had some interest across different sectors in the work we're doing, because we are building one of the largest data sharing platforms with the most people around social services specifically. And so we're really trying to move other communities. So we've had a summit this last year, and then we're also publishing a toolkit, which if you go to the next slide, what this mentorship really will do is kind of following up on the toolkit that we're publishing this next month, really providing webinars and one-on-one support around how do you build a community information exchange within your own community, and really the policy and governance that's required in order to do that. And so as your community is trying to share longitudinal records across health and social services and really work on big issues, if you go to the next slide, really looking at how do you really solve for improving quality of life, improvement health indicators, addressing inequities. How do you really create the systems and change systems through a community information exchange to move that work? So that's really the goal of what we'd like to help other communities build, is really the infrastructure for that. If you go to the last slide, so those who would like to join us that are interested in making progress toward building a CIE, this is really for all sectors, not just healthcare. It could be a community-based organization or a backbone organization, really moving towards person-centered whole person care. For more mature nonprofits, organizations, or healthcare organizations that have already tried the referral capability, but they're really moving towards a more robust, holistic approach to community care planning. And so that's us in San Diego CIE.
Thank you, Karis. Go from one end of the country to the other, from Karis to Katie. Katie Sensei from Maine Health InfoNet.
Hi, good afternoon, everyone. I would like to sign up for all the other mentorships, Peter, if that's allowed. Awesome slides, you guys. So my name's Katie Sensei, and I've been working for Health InfoNet for a little over 5 years, and I'll take you through just a few brief slides about who we are and what we're hoping to offer the folks that join us. So in Maine, to just sum it up, what we've been up to for over 10 years now is supporting our core clinical data set that we provide out to all of the healthcare providers across the state of Maine. And we continue to expand the type of data we bring in, such as the social determinants of health, and expand access to our data beyond traditional healthcare providers. We deliver real-time notification services that allow people to follow up and locate patients across the healthcare services sector. And we also have been doing predictive analytics with our clinical data, claims data, and social determinants data. And speaking of zip codes, we have census information that is a huge driver for outcomes for patients. So I can relate to a lot of the things folks have said. Next. We've been working with many partners. We just have some key highlights here. And all of our partnerships over the years have started really with planning, community convening, strategic planning with partners to first figure out what's the plan for sharing and integrating data across different sectors, even within the healthcare industry. How are we going to do this? And part of our work is always around consent and folks consenting to share different types of data across national and local sectors. And so there's lots of legal issues that have to be dealt with across all of these projects and people. And everything we do is what we call patient-centric or person-centric, as you've heard. And so all of the systems that we've been working on with our partners is really how to wrap around an individual person and tell their story through our data services. So whether it's a hospital or a mental health organization, a homeless shelter, the Veterans Connection that we are connected with, or our partners at the state offices, Medicaid, housing, and then our community action agencies are just some key examples of the variation of the stakeholders and projects that we've worked on to exchange and share data. Next. So we started off as a concept, and through convening many stakeholders and working with state legislature, we finally were incorporated and have been able to become a statewide clinical data repository that's now incorporating many other types of data. So we'll continue to grow, and it's always something new. So we're not sure what's next, but it's always changing. Next. So for our mentees, we really have learned a lot of lessons about what does not work well when you're trying to share data, and along the way have learned really what have been the key successes for successful convening and listening and figuring out what ultimately your audience needs. What does your end user need, and what's going to inform their day-to-day work and help them improve. So there's no time, nobody has time, and everyone's looking for efficiencies and how to do things faster and better. So we've really had to take an industry that is being squeezed and has less and less of a budget in healthcare, and figure out what is the very specific data that they need and deliver that in a very useful, efficient manner. So we have a lot of experience in that and are hoping to apply that experience potentially not to a healthcare industry partner, but maybe to some other partner and share the and leverage that experience that we've learned. And then really to figure out, you know, in what ways can we deliver that? So how do we share that? What's the management of that process? What are the privacy, security, technology issues around delivering that actionable data? Next slide. In terms of outcomes, I think, you know, we really have left this a little bit broad because I think everyone needs something a little bit different. And so I'm really interested in figuring out what are the specific products that you need. Is it documentation? Is it training? Is it project planning, strategy work? I think some of the other folks have given some really specific examples of the tools that you can use to work through some of these processes. So we're, I think, along the same lines, trying to do the same thing, and then identify also the peers and the commonalities that we have, and connect you all to the All-In Network and who really are the experts in the industry around those things, and bring in some information, whether it's through a webinar, one-to-one calls, or direct technical assistance from our technology
real quickly,
team.
Katie.
Sure, no problem. So who should apply? So I think we will, again, less is broad to folks maybe working in healthcare or wanting to work with a healthcare partner, that development, technical assistance, workflow, and user interface development. And so I think it's helpful to have some clinical data experience, but it's not required. So I guess I will end there, Peter. Thanks.
Thank you, Katie. I want to, boy, we're just going back and forth across the country. Go back out and turn it over to Nikki Olson.
All right, sounds good. Happy Monday, everybody. I'm starting to see what I think is a reassuring pattern across these mentors that I think will help us really learn from each other as we do this. So next slide, please. My name is Nikki Olson. I'm Associate Director of the Center for Outcomes Research and Education, or CORE. We're an independent research, evaluation, and analytics center focused on improving health of communities, and we're based in Portland, Oregon. Next slide. So CORE is made up of over 40 staff with expertise that we want to tap into through this mentorship in research that ranges from health services research to community psychology. We focus deeply on the intersection of health and housing in our research, but we've also done quite a bit of program evaluation and claims-based analysis. Our data science arm focuses on building data solutions for CORE as well as our clients. They bring expertise in data systems architecture, analytics, statistics, data visualization, measurement design. Again, we work most deeply with healthcare claims data, program data, geographic information, and recently really have been delving quite a bit into housing authority data. But our DASH mentorship team, the smiling faces you're looking at now, bring a focused expertise on the cross-section of people, data, and action, really working across a spectrum of folks to design data strategies, and in particular, kind of how those strategies can apply to programs and policies and answering questions. We like to describe ourselves as being excited by new challenges, bringing kind of a nimble, flexible, but practical approach to what we do. Next slide. So what I'm trying to say is, like I think a lot of the mentors, if you're looking to kind of work deeply through your challenges with a partner, we can probably help you figure that out. So like everyone, we still have a lot to learn because this is a new field, but we worked with many different organizations to tackle this challenge, from state health authorities to foundations. Primarily our work is along the West Coast in Washington, Oregon, and California. But just the common, as I try to think about kind of the common experience that we've been through across all the different efforts that we've touched working with cross-sector data, is that all of our partners that we've worked with are trying to do something new, and they enlist our help to design and build and move to action, and that takes so many different forms. In some cases, we're hired to extend their capacity and efforts, and others, we help them build their own internal capacity. But in each case, we've just had to figure it out, to figure out something new, not only for ourselves, but for the broader community. Next slide. When trying to think about how to describe the problem, it just kind of left with some of the similar sentiments of the other mentors. It's just really complex. You need to consider so many factors from your audience, the sectors involved, your goals, your use cases, your capacity for implementing and sustaining solutions. So, you know, as everyone says, as the awesome development of frameworks and the body of literature and evidence grows thanks to efforts like All In, there's going to be more toolkits and guides to helping us get started. But really leveraging a body of experience and just troubleshooting through specific challenges. You can hit next, please. Is kind of what we're trying to bring to the equation. We can't offer a specific solution to any single problem, but we'll work with you at any stage to understand your circumstances. I like to say we love the forest and the trees and the weeds for that matter, sort of processing all the factors at play to achieving your goal and figuring out how to get through it. So next slide. Because I can't just tell you that we'll help you figure it out. That's a little vague. Here's some more details on what it could look like. Sharing data across sectors can be kind of oversimplified, we think, into 3 stages. 1, bringing the people together. 2, developing out kind of the details behind your use case and your approach to sharing data. And 3, developing a solution both with data and action. So in the first phase that we're highlighting here, we can help you think through, again, like many of the other mentors, developing a common goal, identifying who should be at the table, facilitating a collaborative approach. We've listed some sectors here that are sectors that we have worked with or have done deeper kind of cross-sector data work. Next slide. In the second stage, which I would argue kind of feels the most complex or opaque for guidance, is really getting into the weeds of the use case, thinking through the programmatic policy research priorities you have, developing the key questions, figuring out the best approach to measuring and developing indicators for those, identifying who owns the data, what are the data sharing regulations around that data, and kind of creating a value proposition. So those kind of steps and stages and questions are the things that we've had to do, again, many different ways, different times. And we're primarily used to facing those challenges with the use cases we've bulleted out here. We are not essentially your HIE help. That's more some of the other mentors who have spoken. Next slide, please. Finally, in the third stage, we can help you think through the questions you want to answer. Identify the audience. How will they use information? What level of information do they need? Who would be able to work with the data? What's the best solution? I think this was already said, but what is the most practical, economical approach to doing your cross-sector data work? Next slide. Bringing it all together, if these use cases, sectors, data solutions look like you and describes your work, we may be a good fit. I just want to emphasize again, we really enjoy doing this work. We like to be nimble and practical and really like to be able to get into details. So last slide, thank you for your time, and we look forward to working with, but also learning with you all.
Thanks very much, Nikki. All right, I'm just really amazed at everybody. This is so great. I want to bring in Gabriel Schuster from the Corporation for Supportive Housing. The CSH offering is a little bit different from the other mentorships, but we were so excited about it, we wanted to include it as part of what might be possible if you are a good fit for them. Gabriel, go ahead.
Thank you so much, Peter. So my name is Gabriel Schuster. I'm a program manager in data and analytics at the Corporation for Supportive Housing, and we can just jump to the next slide. So first off, I'd like to just thank Dash for offering this opportunity and say how excited I am to be on today. To provide a little bit of context, I wanted to start by quickly framing out who we at CSH are. We can stay on that previous slide, if that's okay. And what we do, and then I'll move into an overview of some of the key terms and concepts that we'll hear throughout the pitch, dig into some specifics of our goals and objectives as mentors and what a successful mentee might look like. So it's no surprise that at CSH we do work around supportive housing. We're not direct service providers, however, we work to engage vital public systems to adopt supportive housing, allowing for the shifting of public resources. In this sense, mentorship is really at the core of a lot of the work that we do. And the idea of system change, which we think of as a reorganization and reorientation of how administrative systems operate and work together, is essential to providing the best outcomes for our country's most vulnerable individuals and families. We think of system change as an evolving and iterative process that can take years, but our expertise is in coordinating change on a faster timeline. And we know that better data can help communities advance systems change more quickly and more effectively, and our Dash mentorship is predicated on this idea. Next slide, please. So before we get into the details of our specific mentorship, I just want to review some key terms that are going to come up a lot in this type of work. So first, HMIS, almost always shown in its acronym form, actually does mean something. So an HMIS is a homeless management information system. which is actually a pretty broad term, and it describes a whole class of databases that are used to aggregate data about homeless persons while maintaining confidentiality for their clients. Next up is a continuum of care. We can stay on that term slide, yep. So more often abbreviated into COC, continuums of care jurisdictions that oversee the administration of housing and services for homeless families and individuals within their geography. They're usually not part of a local government, and they often exist on something akin to the county level. Coordinated Entry System, or a CES, is a HUD-mandated system that's designed to identify people in housing crisis and connect them to assistance based on their needs. And in a well-functioning CES, individuals are assessed and are quickly provided with the specific types of housing and service interventions that can help lift them out of crisis. And the last two things are really core to our project. Data matching is the process by which multiple data sets, each capturing identifiable data pertaining to individuals, can be compared against one another and unique individuals identified across both data sets. And lastly, data integration is the result of ongoing data matching. So it's how we describe a system that's set up with the right data and the right tools, such that multiple administrative data sets can talk to one another, and the results can be funneled to key decision makers in the community. Next slide. So over the past year, CSH has worked with the University of Chicago's Center for Data Science and Public Policy to develop an open source data matching tool that can ingest HMIS and jail data. And we can stay on slide, thanks. Even better, the tool was designed to be modifiable by users and has the potential to integrate other administrative data sets, such as those coming from the health system. And communities can use this tool to identify their highest utilizers by feeding data into the tool, which will then output an integrated data set that looks at system utilization at the individual level and across multiple systems. Next slide, please. So communities can take the knowledge generated through this process to then target those individuals for robust interventions, supportive housing being one really obvious example that we like to lean towards. And it can better focus the resources that they have to match their crisis response tools to the individuals in highest need. And because the Department of Housing and Urban Development, or HUD, as everyone more commonly knows it, allows integrated data to be used in the coordinated entry system, the results of this type of data matching can be very helpful in connecting high utilizers to resources. Next slide, please. So as Dash mentors, CSH is going to help guide its mentees through the implementation of an open source data matching tool built on the foundation of what we worked on with the University of Chicago. So I'm sure many of you are thinking right now that must be harder than just downloading the program and setting it to run, and you're absolutely right. When we talk about implementation, we're thinking much more broadly, so not just about the use of the tool, but about the context in which it operates, the legal obstacles that have to be overcome in order to use match data, the specific use of the tool, and then the strategic planning that comes out of an integrated data system. So our mentorship is going to cover these steps, beginning with guidance through the data sharing process, including a landscape analysis of resources, systems, and key points of engagement in your community. We're going to discuss various legal agreements, from data use agreements to MOUs and business associate agreements that have to be put in place to share confidential data, including health data from hospitals or from emergency medical services. And then we will provide technical assistance in the actual implementation and hosting of the open source matching tool. Lastly, we'll provide assistance in using the results to enhance your coordinated entry system. We can stay on that slide, please. So
last point, Gabriel, please.
Yep, sure. So good candidates, I'll just jump to who would be great for this mentorship and this project will be county level government agencies or COC leaders who are interested in using data, integrated data to enhance their coordinated entry systems. And our mentee cohort can look forward to a collaborative project with opportunities to learn from one another in addition to the guidance that we can offer at CSH. Thank you so much.
Thanks, everybody. We've got 10 minutes. So those of you who've asked a question in the question and answer, we've answered almost all of them. Just as a reminder, we will post as quickly as we can to the FAQ at dashconnect.org. I do want to point out one answer that's really important. If you have a question for a specific mentor, as you're trying to figure out who you might prioritize in your mentor selection, please send that request to Q Kang. Her address is on the screen right now. not because we're trying to block you from getting to the mentors, but we have to provide the same answers to everybody who applies. And so your question might also, the answer to your question might be helpful to others. So we promise that we'll be as quick as we can, and I'm sure the mentors will be responsive to us. So you can send your questions for any of the mentors directly to Q. So let me go back, encourage everybody to keep asking questions. We'll go right up until the top of the hour. One of the questions we got that is kind of mentor specific is we were asked, are any of you using GIS as a part of your work? And I suspect the answer is probably everybody. But is there anybody who wants to speak to that specifically? Any of the mentors, I mean?
This is Nikki from CORE. We do use GIS in almost all of our data visualization work and analytics tools, and we primarily do visualizations with Tableau. So we have a decent amount of experience in using different geographies in our analysis.
Right. Bob, I know that you use GIS a lot.
Yeah, we do. We use it, both kind of desktop, but we've moved away from that a little bit and have gotten into product development and building applications using GIS and mapping. So some of those are under our tools menu on our website if you want to take a look.
I mean, I'll just say, at this point, all 6 of the mentors, I think, are pretty skilled with GIS, at least for data visualization. Got another question, and I don't know this answer as well. Can any of you speak to your experience either implementing or monitoring community health improvement plans with local public health departments?
This is Bill from Civic Canterbury. I think rather than kind of a regulatory version, what we tend to do with public health improvement plans is use those as a point of departure for bringing partners to collaborate together more effectively. Oftentimes there's 5 or 6 different competing plans for a given community, and a key step in effective collaboration is making sure all of those things start to get into greater alignment.
Thanks. Anybody else?
This is Nikki from CORE again. We do that work as well, primarily through our data strategy support for accountable communities of health is the place that we have done it the most often.
Thanks, Nikki.
And this is Karis from 2-in-1. We use our local data to help inform some of our partnerships, and some of the data that we're collecting from the CA helps inform some of that work and the data that's used in the reports, as well as helps to influence, similarly to everyone else, our future kind of strategy and focus.
Anybody else?
This is Katie. Yeah, hi Peter, it's Katie at Health InfoNet. So in Maine, what we've been doing is working with the CDC and their prevention programs around their focus areas that are informed from the various public health surveys and plans. And we've been customizing NQF clinical measures, really looking at using clinical data at a population level to produce population measures that help inform over geographical areas how populations are performing from a health perspective, so that they can help plan and figure out resource allocation at a community level around specific chronic disease goals that they have for improving the health of the community. So it's not specific, but it's related, so I thought I'd mention it.
Okay. We have a question. Is anybody familiar with the Aunt Bertha platform, that information referral and resource and referral program?
Again, this is Bill, City Canopy. There's groups that are using that in Denver to some effect. Our personal experience is that many of them are trying to figure out how to do that and something else. So we have more experience with when they are looking to move beyond that than directly with that platform. But I know it's been a source of a lot of attraction for folks, for sure.
And Karis, I would imagine that not necessarily directly with your communities, but certainly in the 211 networks, you're pretty familiar with Aunt Bertha.
Yes, yes, and to the point that there's lots of different vendors out there and different referral kind of locator and bidirectional referral platforms already existing out there, and we help to integrate some of that data. We integrate some of those platforms into our current CIE and have leveraged the functionality as a kind of starting point, as we kind of mentioned, as a mentorship. If you're looking to kind of move beyond just referral capability, that's kind of the next stage with the CIE, is really doing longitudinal client records and more data integration. But the first step is really leveraging or understanding some of those referral platforms like Aunt Bertha to kind of move the community towards better whole person care.
Right. Okay, so I've got one more question that I'll answer on behalf of the team, and then we'll wrap up. There's a question about what would be the ideal makeup expertise of the team to form a Mentee group. I think, the ideal, although this is going to be tough, the ideal would be to have, one or two people from 2 or 3 different organizations in a community that are trying to collaborate with each other. I mean, obviously, the support for this would come to an organization. I think we answered in the chat that we expect that the mentees will use the $5,000 award primarily for staff support. I'm not suggesting that you try to think about how to split this over 2 or 3 organizations, but the ideal would be to get representatives from collaborations that you are a part of. We recognize that there's a lot of collaborations out there that are sort of, they've successfully developed collaborating around a specific opportunity or problem they're trying to solve, and they're trying to move into data sharing. And so we think that this is really a sweet spot for the mentee. So that's the ideal makeup of an applicant, but we don't suspect that all of the applications will contain that. I want to again point you to the if you can go to the tips for a successful application. Before I go, I'll actually read this because these are really important. I will say that somebody said, wow, it would be awesome to see this dream team of mentors collaborate with a single jurisdiction. And my goodness, it absolutely will. And I think that I'm sure that the mentors, many of whom already knew each other, but I'm sure the mentors are thinking about, wow, I would love to hear from what the other mentors are doing. And so that will be on us at the NPO to work out how to integrate the lessons that we're learning. And certainly the mentors, in our conversations with them in preparation for this, have said, we'd be happy to reach out to another mentor if it seems like that's where the expertise might be. So we have the same sense that you do, caller, that would be fabulous. So just real quickly, please note the deadline date, time, and time zone, November 9th at 3 p.m. Eastern. There's no problem if you submit your application ahead of the deadline. Please make sure that you answer all of the questions. It seems like an obvious thing, but it's a Google form, and I want to make sure that is. If you have any questions or problems, please contact Q Kang directly. She's very nice and very thorough. She will make sure that your questions get answered. And if you wanted to make sure that you've got another person as your backup for the application, please go ahead and make that happen. With that, we're at time. I'm so thankful for your interest in this process. There is a short evaluation. It would help us if you take it as we close out. So thanks to all of the mentors, especially, and to all of you potential applicants. I hope you found one or two things that are exciting to you. I really would be surprised if you didn't. Thanks, everybody, and we'll look forward to your questions. dashconnect.org. Take care.